This next story is going to be different because it's about me. I have some health news to share with you tonight. Last month, I was diagnosed with prostate cancer. It came after a routine blood test led to a biopsy that confirmed the diagnosis. Now, besides skin cancer, prostate cancer is the most common cancer in men, but when caught early, as mine was, it's almost always curable. This is the pathology report that confirms it: prostatic adenocarcinoma, cancer in 3 of the 12 biopsies taken from my prostate. How common is prostate cancer?
Prostate cancer is very common. In this country, it's about 1 in 6 men will get prostate cancer.
Ohio Health urologist Dr. John Bergers is my doctor. He's a renowned surgeon who's treated thousands of men for prostate cancer.
This is the bladder, this is the rectum back here, and this is the prostate.
The prostate is a walnut-sized gland that helps create semen. Because prostate cancer is very slow growing, many men will never die from it. But early detection is key, finding it before it spreads. What have you learned about me and my prostate?
All right. So in your case, Kurt, what we have found is that the cancer looks to be contained.
That's good. There are 4 stages of prostate cancer. Stage 1 is the best, 4 is the worst. Because mine isn't believed to have spread, it's considered to be stage 1. My cancer is also graded on its aggressiveness, the Gleason score, a number from 1 to 10.
So ideally, we like to find them in the 5, 6, and 7 range, and yours being a 6 is right in the middle of that, which is ideal. So a stage 1 cancer with a medium grade, stage 1 medium grade cancer, very ideal for cure.
That's great news to hear. Prostate cancer treatments can range from what's called watchful waiting or active surveillance to surgery, radiation therapy, cryotherapy, hormone therapy, chemotherapy, and more. So the treatment that seems to be the most appropriate in my case is to remove the prostate.
Yes. Usually in men that are younger, we usually recommend that. It has the best cure rate there is for any type of a cancer.
So I will be having surgery next Monday at Riverside and then take a couple of weeks off to recover. The rest of this week, I'll be focusing on prostate cancer. Tomorrow, we'll learn more about a simple blood test that found my cancer. We'll tell you where you can get a test. And on Friday, you'll get to see the kind of surgery that I'll be undergoing, so we hope you'll do something about it. It is Prostate Cancer Awareness Month.
Okay, well, you know, it's good of you to share your story because hopefully people can learn something from it and get tested.
Well, I think so. That's kind of what I want to let people know about. This blood test that's so important, this PSA test, can really save lives, and we're going to learn more about that tomorrow and in the days and weeks ahead.
All right. Very common, very curable.
It is,
Absolutely.
if it's caught early.
So, yes, and you caught yours early.
Thank you.
Was that just part of your wellness
visit?
It was.
Or
or did you specifically say, no, test me for this?
This was part of my primary care doctor who's been doing this test on me since I turned 50. It's really for men 50 and over to do this test, and the numbers kept going up, and he said, we ought to do another test, and that led to the biopsy, and here we are today.
So that's part of the variety of tests that they test when they take your blood?
Well, this was a specific test that he ordered, and not all doctors believe in this test, and that's part of the controversy that we'll discuss tomorrow, because not everybody thinks it's a good idea. Obviously, I think it's a great idea because I found it and hopefully saved my life.
Wow. Thank you for sharing that, man. That's an interesting
Appreciate all your love
that I'm
and
kind
support.
of focusing in on myself. So.
Everybody here has been great today, so thanks everybody.
Awesome, man.
September is Prostate Cancer Awareness Month, and it's interesting because it comes at the same time that I was recently diagnosed with prostate cancer. Thankfully, it's stage 1, but it was diagnosed after a very controversial blood test. I'm going to show you that in just a second, but a warning first, you're going to see a graphic that contains the male anatomy.
Hi, Tim.
Tim Duffy is getting his blood tested for prostate cancer, a PSA test, prostate-specific antigen, a protein produced by cells of the prostate gland.
I work in an office where I see a lot of cancer, and the PSA is one of the indicators that's an early detection, so it's a good opportunity for me to have that test done to see where I stand.
Before the PSA test, there was only one way to find prostate cancer.
In the old days, it was found by doing a digital rectal exam. Digital, some people think that means computer, but no, digital meaning your finger, the digit.
Been there, done that. But prostate cancer can't always be felt by a doctor until it's too late.
And in those days, when we operated on a patient after we found cancer, we had a 50-50 chance of curing them of the cancer. But since PSA's come along, we are now able to cure over 90% of the men. So it's dramatically changed our ability to find prostate cancer. We find it much earlier than we did before.
Dr. Bergers recommends that men start being tested at age 50,
I sharpened it just for you.
age 40 for African Americans or men with a family history of prostate cancer. But opponents, including the U.S. Preventive Services Task Force, think the test harms men who wouldn't die from the disease by subjecting them to side effects from surgery, radiation, and other therapies. Thank you.
You're welcome.
I mean, without you, we wouldn't be doing these stories, and I wouldn't be getting the surgery that I need. William Grauman is my primary doctor, a believer in the PSA. He ordered the test that found my cancer early and likely saved my life.
If we don't treat your prostate cancer, you're still going to be alive at 13 years, but your prostate cancer will unlikely be curable at that point. And metastatic prostate cancer is very painful. It's a very gross way to die. We can do something about it right now, and I prefer to do that.
26,000 men died from prostate cancer in the U.S. last year, down from 48,000 in 1991. What is the message we want to send to men and to women who have men in their lives about prostate cancer and the importance of early detection?
I think what we want to say is, if you're going to get a cancer, prostate cancer is not a bad cancer to get if you catch it early. Because if you catch it early, we have treatments that can cure the cancer and still have a very high quality of life afterwards.
Now, those treatments can range from surgery to chemotherapy to even radiation. I'll be having surgery on Monday at Riverside. Dr. John Bergers is my surgeon. Looking forward to that appointment with you on Monday. You've been gracious enough to take a lot of phone calls tonight. Yeah. What's the most common question you're getting?
You know, we've been getting lots of good calls, but the most common is symptoms.
And what are they?
Yeah, and that's unfortunate. There really aren't a lot of symptoms until the cancer spreads, and that's why this PSA is so important. Because if you wait till you have symptoms, it's too late. So the symptoms usually are when the cancer spreads to your bones. You start having severe bone pain.
And that's the thing about mine, is that I didn't have any symptoms, and the digital rectal test didn't find it, and the PSA did, and so we're thankful for that. All right, get a good night's sleep on Sunday night, will you?
I will.
All right,
thanks.
Thank you.
On Monday, my colleague Kurt here will be undergoing surgery to be treated for prostate cancer.
Yeah, the technical term is a robotic prostatectomy. Basically, my doctor will be poking a few holes in me to remove my cancerous prostate. Now, be warned, some graphics in this story show parts of the male anatomy.
Once we get it out, we can see exactly where was the cancer. Was it encapsulated? Was there any sign of it spreading or doing things that we might not have detected before the surgery?
Dr. John Bergers is heading up my surgical team.
Now, in order to do the surgery, we come in through here. So you can, and we push the bladder up this way. So you can see how that's a little tiny space.
This is how they'll do it, using something called the Da Vinci surgical system.
Da Vinci surgery is robotically assisted and also minimally invasive. Da Vinci is 100% controlled by your surgeon, offering excellent vision, precision, dexterity, and control.
Dr. Bergers will work from a magnified 3D high-definition vision system using tiny instruments.
Its instruments have tiny wrists that bend and rotate.
So as opposed to making an incision, we make little holes, fill the belly with gas, and that gas is what creates the space to work in. The instruments are placed into these holes, and then they're attached to a robotic device. Now, the advantage of that is that whatever I do with my hands on the outside, it does for me on the inside. So it's as if I had you open without opening you.
During the removal of the cancerous prostate, Da Vinci's vision system and instrumentation help your surgeon to operate around the delicate nerves and muscles that control urinary and sexual functioning. First, the prostate is carefully detached from the bladder. Then the nerves are gently removed from the prostate using nerve-sparing techniques.
Once the prostate is removed, it's pulled out through one of the small holes. Then the bladder is reattached. And hopefully I'm cured, like most other patients whose prostate cancer was caught early.
It isn't a death sentence. It doesn't mean that you're going to have a terrible life, afterwards. We can now cure it because of the technology and all we have, and because we're finding it early enough. We can cure it, and you can have a very normal lifestyle afterwards.
And while they are inside, they'll also pull a few lymph nodes to be sure the cancer hasn't spread. I'll have to have a catheter for a few days, but I hope to be back to work within about 3 weeks or so. Well, as most of you know by now, my prostate was surgically removed using a remote-controlled robot. I'm about to take you inside the operating room. If you're squeamish, be warned. Besides seeing video of the surgery, you'll also be seeing a model of the male anatomy.
You ready?
Am I ready? I'm ready. It's early, and I'm checking in at Riverside Hospital.
Kurt Ludlow, Ludlow.
I'm about to have surgery for the first time since I was a little boy.
Let's get this prostate out. Who needs a prostate anyway, right? I don't.
What have you learned about me and my prostate?
All right. So in your case, Kurt, what we have found is that the cancer looks to be contained.
Diagnosed with prostate cancer at age 55. My treatment choice, remove the damn thing.
This is the bladder. This is the rectum back here. And this is the prostate.
My surgeon, Dr. John Bergers.
Now, in order to do the surgery, we come in through here. So you can, and we push the bladder up this way. So you can see how that's a little tiny space.
Too tiny for a surgeon's hands to fit, but the right size for a robot.
This is Kurt Ludlow. Today we're doing robotic prostatectomy on him.
A robotic prostatectomy is considered minimally invasive surgery. You'll see why in a moment. Within minutes of being wheeled into the operating room, they put me to sleep. The surgical team is assembled.
I'm Dr. Bergers. I'm the surgeon.
I'm Joey assisting.
Val Scrub. Here's circulator.
Dave anesthesia.
The rock music is cranked up, and the surgery begins. Dr. Bergers will operate through just a few small holes using miniature instruments that are attached to the Da Vinci robot. First, a camera is inserted into my body, giving the doc a 3D high-definition view inside. He'll manipulate the robot, working remotely from several feet away.
The instruments are placed into these holes, and then they're attached to a robotic device. Now, the advantage of that is that whatever I do with my hands on the outside, it does for me on the inside. So it's as if I had you open without opening you.
Everything is magnified 15 times.
And there's the bladder back there. And the prostate exists down in here. So we gotta go down in there.
Slowly and deliberately, he works his way to the cancerous prostate, carefully cutting it free while protecting and saving important nerves that surround it. He puts the prostate into a plastic bag and pulls it out of my body. Then everything's reconnected.
All right, reflection of the bladder looks good, no leaks.
And with that, I'm cancer-free.
Okay, there it is, all done.
This is what they came for.
That's the prostate right there.
That's the prostate with it out, yep.
Minutes later, they're waking me up
Deep breath in.
and preparing to move me to the recovery room.
Okay, Kurt, we're on our way to the recovery area now.
A few hours later, still bloated from the gas they used to expand my belly, I'm at peace with my decision.
So surgery isn't an option for everybody, and it's not the right option for everybody. For me, it was the right option because I just wanted it out. I didn't want to have to worry about it anymore, and I feel like this was the best decision for us.